Do you want to take this and do this? Then join me, Terrence Irvin, Parish Program Coordinator for the Great Ascension Trash Bash, held on March 26th through the 31st. There will be a Trash Bash Award ceremony on Saturday the 31st at 11 a.m. at the Ascension Chamber of Commerce in Gonzales. There'll be food, prizes, and fun for the whole family. Bring the kids, bring your family, bring your friends. But most of all, bring your love for this parish. That's the Great Ascension Parish Trash Bash. Let's clean it up together.
Okay, my monitor's not working, but I think we're on the air, so we're going to call this meeting to order. It's the Ascension Parish Mental Health and Addictive Disorder Advisory Board. And the first order of business tonight is to introduce y'all to our secretary. Celeste, would you like to introduce yourself to the public? We appreciate you being back.
My name is Celeste Koki, and I'm the office manager at the Mental Health and Substance Abuse Clinic. I also was serving as the secretary for the past few years, and the last few months hadn't been, but I'm back on now.
Thank you. We Thank you for being back. We appreciate having you and hope we have the same good relationship we had in the past. Thank you. Ladies and gentlemen of this board, I don't know if any of you don't know that our secretary has been read.
Yes.
Jerry?
Yeah.
Thank you. Okay. Do we have any 2/3 vote tonight? No, I'm sorry. I skipped the minutes. Number 2. And I need to add that we have January and February's minutes also. Does anybody have any corrections? You want to take them one at a time? All right. How about December? Anybody have any corrections on December's?
No corrections on December.
Would you like to make a motion that we accept?
I'd like to motion that we accept the December minutes as written.
I'll second.
No vote.
Yes.
Okay. Thank you. January meeting.
I motion that we accept the January minutes as written.
I'll second.
Does anybody have any questions on the February ones? All right. Can we get a motion on the February?
I motion that we accept the February minutes as written.
I second.
Thank you. No objections. Sorry, I presume that. 2/3 vote. Anybody with an emergency thing to go on the agenda? Any public comments? Number 4. Number 5, Ms. Brenda, needs assessment.
Okay. I just have a very brief update on the needs assessment. I know that the consultant from Robert Rose did speak with some of the board members, as she had agreed to, Mr. Butler and Ms. Gautreaux. I assume that she answered all of your questions?
She did.
Yeah, she did magnificent with mine. She had some great ideas as far as meeting the needs of the people. Great ideas, not just for Down syndrome, but for the whole parish. You know, different things about different programs I mentioned to her, and she's looking into it. So she's going to get back with me, and I really appreciated talking with her.
Okay.
Very good ideas.
And on a Tuesday, Miss Z and I went to Donaldsonville. We did stop at the mental health building, and we run into Jerry there. We did a lot of other travel that day. We got him up with a lot of ideas from the ministers, from just anybody and everybody that we ran into, and I gave all that information to her, and we discussed how we could go about maybe making it easier for people to become us to serve the people and all this, and everything was great. I enjoyed my conversation, and we talked for a couple of hours.
Okay, great. Well, then I believe the plan is for them to present their proposal to the board at our April meeting.
Yeah, because she said she's gonna come, and one of the really positive things that I like about it, she said when she comes, she's gonna come with a packet where all the available grants that fit the needs that we need.
Oh,
so that's a positive note.
Great.
As far as we moving forward, So I look forward to it. Anytime you need me, just call.
Okay, great. Well, then we should hear from them, and we'll put them on the agenda for the next the meeting in April.
Okay. And on the budget, I had stated that myself and Ms. Z would go into the office and talk about last year's budget. Well, I didn't get my information clear as to what I wanted. We did go in yesterday. We did talk about the budget, but the budget for the month, Ms. Celeste is going to give it later on, and the yearly budget, we're going to try once again to go in on the second Wednesday before of the month and discuss the budget where we know exactly where we stand in every department. And that was my error, and so I will get back with you fellas on last year's budget next meeting.
Okay.
Okay. We have, Ms. Susan put in our package last month a review list for grants. And on this review list, I was rather disappointed in it because I came up with 3 of the grants that's on this list we already have, so we can't propose that we look into that one. We have 6 grants that we would have 20 days or less to apply for them because the application date is due on them within that time. That leaves us with 10, and out of the 10, we have 6 that parishes are not eligible, or professionals are not eligible, or Ascension Parish is not eligible on one of them. That leaves us with 4, and they 501 grants, and I don't know if we could be considered a nonprofit organization or not. Celeste, would you have any idea whether we would be considered a nonprofit organization?
I'm not quite sure.
So we need to look into that. Okay, thank you. And I did pull some information up on their internet and how many grants are available out there. And there is a whole lot of grants out there. So maybe we will go back and pull a list of grants that we think are necessary, and anybody else that has time to look up on their internet, there is a large number. I think there was 300,000 grants available.
And
The lady from the needs assessment, she did mention that, what you just stated. She mentioned that to me over the phone about all available grants. They are out there. I mean, we just got to go out and...
Well, I just thought when I asked for a list, she would have given me a list of ones that we were available to apply for.
Okay, as far as mental health, okay, I understand what you're saying.
Yeah.
Well, and what I would suggest is that once we get the needs assessment, we prioritize where we want to focus, and then put together a packet and look for grants specifically around that, because with that many grants out there...
That's the question I asked her. She said that the one she's going to submit to us is the one that we can qualify for.
Yeah, and that we show need for.
Correct.
So
correct.
I think once we can narrow down our focus, then it might be a little bit easier, and find some that maybe give us a little bit more lead time to apply.
Well, thank y'all for that, and I do intend to keep looking into following us some grants. Okay, number 8 is the approval of the DA's invoice.
I'll make a motion.
Excuse me, Jerry, it wasn't in our package. Was it in what she presented tonight? Does anybody?
Thank you.
DA?
It was in the packet.
All right, so we have it. Good. Okay, Jerry.
Okay, I'll make a motion to approve the invoice for DA office for the drug prevention program.
A second.
Any objections?
No objection.
If not, motion passed. Thank you. status report for Mr. Ryan, and he works with the state in the Gonzales-Donaldsonville area.
Good evening.
Good evening.
How y'all doing?
We're good.
Good. First of all, I passed out the statistics before the meeting, so if you have any questions about that, I would be happy to answer them.
The total new cases, is that,
That's together, Gonzales and Donaldsonville. Yeah, that's both of them together. I think
like there was a little increase in last month? Huh?
Yes, it is.
Okay.
I didn't separate them out, but we had 9 new cases in Donaldsonville, and the other ones are from Gonzales.
Yeah, I noticed that from the last report and this one.
Any other questions? Okay. A few things that I wanted to go over. One was that I wanted to remind everyone of the April 2nd meeting that we have with the West Ascension Ministerial Alliance. We will be discussing Donaldsonville Mental Health Center services, the referral process, mental health and addictive disorder support groups, and the church's role in these, and addictive disorder prevention. So we have myself and one of the nurses from Capital Area, as well as one of the prevention specialists is going with me to this meeting. So I've talked to Reverend Williams, and we will be on the agenda April the 2nd. Any questions about that?
The time again?
6 to 8 o'clock.
6 to 8.
Yes.
A lot of them should show up because I spoke with Reverend Williams on yesterday.
Okay, good.
And they're supposed to turn out.
Good. That's good. Last meeting, Ms. Zenobia had asked me about the resolution and the reallocation of money that was the resolution was written for. I talked to Dr. Kosofsky, and she said that the reallocation of money is for services rendered. This is so we can continue to provide services to the increased population since Hurricane Katrina. So that's what she was. That's what the resolution was for. Okay. We had to increase our services because we had an increase of about, in Capital Area, of about 70%. And so that was why they were asking for the reallocation of services. I don't know that it has anything to do with the $88,000 that they had previously given to y'all for us using the building.
Okay. I'm aware that it didn't have anything to do with the $88,500. Okay. My question was, since Ascension Parish is the second in line to East Baton Rouge Parish,
sure,
then I wanted to know the monies that would be funded. And we've had some increases as well.
Well, what
portion would we be receiving?
Well, what it would pay for is the increase in staff that we needed
for the state. Yeah.
For the state. Yes.
Okay, that clears up my question. Thank you.
You're welcome. And the last thing that I wanted to say was that our executive director, Dr. Jan Kosofsky, was presented with the National Association of Social Workers Louisiana Chapter's Public Citizen of the Year Award. So she was, we went to the lunch and the awards banquet yesterday, and she received this award because of the aftermath of Hurricane Katrina and all her efforts in that. So I just wanted to announce that to y'all as well as Ascension Parish public.
Thank you. Great.
Any questions that you have for me?
Give her our congratulations and tell her we sure believe that she deserved it.
I will definitely tell her that. All righty.
Thank you, Mr. Ryan. The parish status report given by Dr. Susan Menedoff.
On the activity statistics, you'll see that we saw that we provided 754 patients this month, February, and a total of 1,028 services were scheduled, which is a lot for a short month. So we had a very busy month. On the grants, can't wait to get some.
Wait, please, Susan.
Yes.
We have item C would be the budget. You want to wait and let Celeste discuss the budget at the end of yours instead of in the middle? We go into A, B, C, okay?
Okay, are you looking I don't have the budget on my current report.
Well, I'm sorry, we're going by the report we received in our package.
Okay, that's only an interim report. It's not up to date, so I suggest that you look at the one that I gave you tonight.
Well, I suggest that I don't have time due to the fact, and we're supposed to put this out for public, where they can have a public comment on anything that's on our agenda. So
I'm going to
if
give my
anybody would-
report.
I'm sorry, if anybody wished to have had anything on what I sent out as my agenda, they would have a right tonight to speak.
They're welcome to speak. I'm not saying...
Well, that's how come we going A, B, C, like you sent it to us in the mail.
The next thing I'd like to discuss is grants. Governor's Safe and Drug-Free Schools and Communities sent out their request for applications in late February. I'm now working on that grant that's due in April. Our award on that has been decreased every year for the past few years, so we got $40,000 last year for a substance abuse prevention grant. It's going to be decreased to $25,000 to $30,000. And I'm going next week for 2 days to meet with the governor's office staff, because all the people who receive funding under this grant have to come and do a training. So I'm going to be doing that next week. So the grant is due at the end of April. Our capital area prevention grant is due mid-April, and it is also going to have less money than it's had in previous years. They're cutting it down. They didn't say how much they were cutting it down. I think we get $36,000 something this year. So that's going to be cut also. And they're increasing the number of things we have to do under the prevention grant. So any other questions on grants?
I do, Susan. I have one question. Is there a yearly report or some other interim report on the outcomes of the grants?
What do you mean?
When you set the outcomes when you apply for the grant, for instance, the prevention one. Let's just take that one, and the program that it funds, the prevention program for adolescents at the alternative school. I assume you all set outcomes in
performance indicators. Yes, we do.
Okay.
Yes.
And so, is there any interim review of that and report on that, or is it just at the end of the grant
At the end of the
cycle?
grant. Uh-huh.
Okay. And so we are reapplying before this grant cycle finishes.
Yes.
And how does
and we do that every year.
Okay.
That's the way it is every year.
Is the award impacted at all or based on how we reach those performance indicators or how successful it was?
I'm assuming that we have to meet our performance indicators to be refunded. We expect to meet our performance indicators.
Well, I guess what I'm wondering is if it has to be in before.
The grant's not over until the end of June,
right?
And the award will be made by then for the next year. So they always run behind.
Okay, and if we're not having a report on how we did, how we did in meeting those performance indicators, then how do they review that? How is it looked at? Do you know?
You'd have to ask the governor's office. I don't know. We'd give them the information they asked for in the RFP, and they asked for information on how we met our goals so far, so we provide the data.
Okay, so it is an interim on how you've met it so far. There is some interim as you're applying for the next
It's part of the grant application.
Okay.
I'm sorry, I didn't understand what you were asking.
Okay, and so part of the new grant application looks at how we have been meeting them in the past. Okay, so I assume that you are happy with that project and the way that we use those funds, and is that same project continuing? Is there any change to that project?
No, last year was the first year we did the project, because the year before we had used prevention grants to fund an actual program, a different kind of program, and they tightened the requirements and said they would no longer do that last year. So I'd spent a lot of time. Actually, I rewrote the grant 3 times until I came out with something that looked like it would be acceptable. And they did accept it, so we're going to go with the same thing this year. This is the Strengthening Families program in Donaldsonville that we just got started in January.
Okay.
That's what the Governor's Safe and Drug-Free Schools and Communities funds.
Okay. The one, and then the one that's the Substance Abuse Prevention Grant, that capital area
Capital
funds.
area. Mm-hmm.
Is that at the alternative school project?
Right, those are our
towards no drug
services at
abuse?
the alternative school and at the clinic. Uh-huh.
Okay. So that's really providing for a counselor at the school. Is that what that is?
Partially. It's not enough money to pay for a counselor, but it's partially.
Okay.
It pays for a prevention program then they use toward no drug abuse. Yeah.
Okay.
I need to get a board decision on the capital area memorandum of understanding or letter of agreement that.
Ms. Celeste, would you set up an appointment with the Personnel Committee? That's where I was told we have to go, and I've been trying for 2 months to get that meeting set up. And there's going to be several items that we need to put on the agenda that we're going to speak on in front of the Personnel Committee.
Is this going to be one of those items?
This is one of the items, yes, ma'am.
Okay, so you're deferring action on that? Okay.
Yeah.
Okay. I also need board approval on the revised policies and procedures that I gave you all in December.
And Celeste, that is also to go to that committee. And it's also on our agenda on item 12 when we will be talking about it again.
I'm sorry, I don't know what item 12 is.
It's on our agenda as item 12, the same.
Oh, okay. Also need board approval on policies 501, 1001, 1004, which are new policies.
Susan, we haven't approved the last policy and procedure manual, so until we get that one approved, we're going to hold off on this, please.
Okay, do you think we could do it in a fairly timely way? We have a licensing audit coming up, and we're
I
supposed
know
to have
we have a
them.
license and an audit, and I have been trying. I first went with Mr. George. I reported that to y'all. He told me I had to go in front of a committee. Now it's Jerry Sawar, and I've talked to Jerry, and he was out of town last week, and he said as soon as he could get that committee set up, we could go in front of them because this has to be approved by the council, and I would like for it to be approved because I know it is time for us to get our licenses, but we haven't gotten in front of the Personnel Committee, and then the Personnel Committee refers us to the whole council. We can't just go to the whole council anymore.
Okay, and you should know that there are going to be continual revisions to various policies as the year goes along. At practically every meeting, I'll be bringing them.
Well, that's another thing.
Mm-hmm.
If we approve a manual for them to come in and give the license, that manual should not be good for the 1 year that the license is good for?
It's good, yes, but different things occur during the year. Revisions are necessary. For instance, the revisions to 501, 1001, 1004 came about because Capital Area requested that we incorporate some steps in handling progress notes that we didn't have. So that's what I did. 501, I added it there. But in order to make it consistent, I had to also add it in the 2 substance abuse policies.
I understand.
So those things come up all the time. Sometimes it's just something we hadn't thought of or something that needs to be changed.
And in the 101, it says we will see patients that are not residents of Ascension Parish.
No.
It says non-residents in the motion. That's why I'm asking that we postpone this until...
No, we don't see any non-residents. I'm sorry. That
Yes,
must
ma'am.
be...
Well,
Okay, I'll be glad to look at that, but nowhere do we see non-residents.
right. That what I was...
The last thing I need some information on is what you all want to do about repainting the Donaldsonville sign. The estimate is $1,000, give or take a couple of hundred. I gave you the...
In reference to the repainting of the sign, well, not really brought to my attention because in the last meeting we also stated that we was going to put on the repairs for Donaldsonville Clinic was going to be on hold until we form a committee
Okay.
in order to go to see about getting these needs done. So
So we'll defer the roofing estimate and the exterior,
until the
interior
committee
painting?
is formed, yes.
Okay. And the last thing I need I would appreciate some action on is the request from St. Paul Baptist Church for a donation.
We also have that on our regular agenda, and it's under item number 14, and we will take it up there, Susan.
Thank you very much.
Thank you. In this, that is number 10, number 11, was the evaluation of the mental health director, and that has been a duty, and by me having to go through the bylaws, the ordinances, and what have you, I found out, and I knew we hadn't been doing it. I don't particularly like it, and I asked for Susan for it Wednesday. She gave it to me, but I do not think it is the one that we usually use. So I'm going to ask permission to ask Celeste if she will find the one that the board usually uses, and I'll bring that back to y'all at the next meeting. Is that fine?
So is that a regular evaluation that the board does on a yearly basis?
Yes, ma'am.
So you're making a
Excuse me,
motion?
Ms. Italia?
Huh?
Actually, every year it's been something different. It hadn't been the same evaluation tool that they use each time.
Okay.
We can go ahead and pull some from y'all, for y'all.
What do you want? Should we use this one, or just wait till let's wait till we pull some and see which one we should
That's
use, because I
actually
don't
the
want to
current one
use. Huh?
The tool you have now is actually the current one that's used by the parish right now for all employees.
For all employees. But
Times
is that the
before-
proper one for this board to use?
I don't know if there was sort of said proper one that should
Oh,
be used.
okay.
But times before, we either pulled the one that the parish was currently using, or the board just wrote up something themselves. And the parish one has changed now. So what you've seen before in previous years was what was at the time
Exactly,
the
I
parish's
understand.
evaluation tool. Now that parish evaluation tool has changed, and this is what we're using, is what Susan gave you a copy of.
Okay.
But I mean, I can pull some older ones if you'd like.
I would like to see, because I'm not particularly in favor of evaluating people. Thank you. Okay, under agenda item number 12. That is the manual, the policy and procedure manual, and that's what she was asking for us to approve tonight, because it does depend on us getting licensing for it.
Okay.
And Ms. Baptiste, do you want to be recognized?
Yes, I do.
You're now recognized.
Okay. Madam Chairman, based on the approval of the policy and procedure manual, we just talked, and there is some revisions to the policy that I'm not quite sure that legal has this information. Okay, we just talked about one of the revisions in the policy states that, and I think you and Susan just mentioned it, that Ascension Counseling Center's substance abuse program will provide non-residential outpatient services for the treatment of substance abuse and dependence. So that's what I'm confused about. She says she didn't, but this is what's in the draft. Okay, so I would like to, at this time, approve the manual.
That means non-residential means that the patients don't live in your facility, not non-residential to Ascension Parish.
Okay.
We're an outpatient center, so we only see outpatients.
We need to put that in there like that, just like that.
Sure, I'll be glad to.
And there are other things that I have came in contact with, but I would like to approve that manual tonight based on the fact that I passed out the organizational chart, and it reads, each one of us have a copy, Mental Health Substance Abuse Organization Chart. It's dated the 11th, the 5th, and 2004. I would like to make a motion to approve the policy and procedure manual tonight based on the fact that this organizational chart is put into it as the organizational chart for the policy and procedure manual, with the necessary corrections that we may go back to legal and make some necessary corrections. Thank you.
Oh, that's one where, anybody want a second?
I second.
Any questions?
Wait, I do just have a question. So the change on it looks like
The office manager, secretaries, and clinical workers back underneath the office manager, out from underneath. Oh, this is not the one that's in the manual. I don't know where this one came from.
this is the new one.
Policy, this is the latest, we
That-
have it tonight.
You just put it in our packet. You just brought it to us tonight.
We just updated it, yes.
Yeah, well, you know.
Well, we haven't time to study this, and if we're going to go back and study that, she made a motion, we have a second, and
The motion stands.
I'm just trying to see what,
yeah, I don't know.
what's
I
the
didn't
difference.
look at that one. I haven't.
It eliminates any oversight of volunteer organizations is one thing. I don't know if that matters.
Okay, but where's your office manager? Where's your staff underneath your office manager? So you have your secretary. Your secretary should be under the office manager, and so should your clerks be under the office manager. They should not be underneath your
Clinical manager.
Clinical manager. And then we have one ethical officer.
Madam Chairman,
I'm sorry,
Yes, ma'am.
I made the
I
motion.
think y'all have an obsolete one.
I made the motion to accept the policy manual that came from legal. It did not have an organizational chart in it. This is the original one that we have been using, and that's why I'm asking that we add this one to the one that legal sent.
Okay.
We have changed the organization. That's obsolete. We no longer are arranged that way. So it's okay to approve it, but the one you have tonight, I beg you to, to put in your.
Well, we won't.
How could we put something in?
We don't even have the same staff members that we had in 2004. So.
All right, withdraw your motion.
Okay, Madam Chairman, I'd like to withdraw my motion and we not approve this manual tonight.
Yes, ma'am. Jerry, do you withdraw your second? I presume
Yeah, I
that's
withdraw my
the way to
second.
do it.
Yeah.
Okay, we will study this and go in, but I still want Celeste to go in front of the Personnel Committee with the manual.
Yes, ma'am. I have it down.
Thank you. Okay. The other, number 13, is the bylaws, and in researching the bylaws, I found that I had left out one of the dates that the bylaws had been approved, Celeste, and I was wondering if we could just go back and put the 202. I want the bylaws to stay the same, except just admit that one was accepted in 202. I left it out.
Do you know that? I'll look up the date.
I have it all with me right here. I'll give it to you tonight.
And what's the date on that?
The date that it was accepted was in 202.
In February 02, is what you're saying?
Let me put my hands on it. There's just one little thing, is to go back and put in there the year that I left out. It's left out of that one, too. It's the bylaws was approved in August the 21st of 203, baby.
203?
Yes, ma'am.
August what? I'm sorry?
2000.
August the 21st of 203. It had been approved by that board. And I left it out in the bottom where you changed the...
I'll insert it and reprint it
All right.
and have it for y'all for next meeting.
That's the only correction on the bylaws that I run across when I was coming to this. Okay. Number 14 would be the St. Paul Baptist Church Fair. Miss Batiste?
Yes. I would like to motion that we set up a booth for the St. Paul Baptist Church Health Fair with literature from the Mental Health and Substance Abuse Department. Not a financial donation, but we can do that.
A second. I think it's a great idea.
Yeah, I do also.
Brilliant.
I had asked Celeste about something, and I still don't know if we can do it or not. We have a bunch of shirts that we have paid for that are in the attic of the building, I think. And I don't know if children would want these shirts. I don't know exactly what's written on them or anything. If we go through and look at that and they're appropriate, could we also put that and hand those out to the children if they wanted them? They're paid for by the board. They're owned by the mental health department, or our tax dollars paid for them, and I would love to get them used if they're appropriate.
Sure.
Celeste, can I come in, or Miss Susan come in and check out what's up in the attic and see if they are appropriate for this health fair? I come in and see if those shirts are acceptable to give out at this health fair. Huh? Okay, we will come by one day. We'll call and make an appointment and come by and check it out. There's no use in those shirts staying up there if a child would wear one of them or they're usable. Okay. Did we vote? I'm sorry. Did we vote on a motion that we would set up a booth at this health fair?
Yes.
Okay, thank y'all. And it passed. All right. Second by Jerry.
Yeah.
Of course, I got a secretary down there that's keeping this for me tonight, ladies and gentlemen. If I get lazy on the
brilliant.
Okay, we have the letter of agreement once again between CAHSD and the parish, and that also has to be put in front of the Personnel Committee. Or maybe I gave you that already. Okay, any unfinished business?
Yes, Madam Chairman. I would like to refer to our minutes of December, about the 7th paragraph, and I'll read it for you.
Oh, okay, because I can't.
It states, the Chairman Gotro asked that more mental health services be provided in the Donaldsonville Clinic. Mr. Butler addressed Dr. Middenoff about the parent and a client who contacted him. This scheduled appointment in Donaldsonville was canceled 3 times, and the client was not seen for a month and a half. The director stated there is no full-time counselor in Donaldsonville because there is no request for services. The director reported that the clinic is only open on Tuesdays and Thursdays. Mr. Butler asked why there was no one from the parish in the clinic. Dr. Middenoff said that counselors are only there when requests are made and appointments scheduled in the Donaldsonville Clinic. There are no walk-ins. Dr. Middenoff stated that if the board would like someone in the Donaldsonville Clinic from the parish, the director stated she would be glad to staff that office. So I'd like to make a motion at this time that Dr. Middenoff would staff the office in Donaldsonville at least on Tuesdays full-time with contacts and information flyers to all the churches. I've counted, I have a list of 32 churches there that we can put information in about the building being open, contact all the schools and the newspapers, the Gonzales Weekly, Citizen, the Donaldsonville Chief, and the Community Mirror, whatever way we can get the information out, even if it's to put another billboard up over there with that information on it. And perhaps we may need the services where we would have to open it on Thursdays as well. So I'd like to make that motion at this time, that it would begin April 1st.
Would you
Shorten my motion.
Yes, ma'am. Would you please shorten your motion just to if you want
So we're still going to have some services on Thursday also?
a counselor in, am I understanding that? You want
Yes.
one counselor in the Donaldsonville
Full-time.
office
On Tuesdays.
full-time on Tuesdays?
Full-time on Tuesdays.
Full-time.
And that's your motion.
That's my motion.
Okay, and
Thursday.
no, just Tuesday.
Appointments only.
Okay, and appointments only to start with, since that's our
Just to
thing.
start.
If y'all would, I'm not supposed to interfere.
I have a question about it.
Do we have a second first?
Yeah, a second.
Okay, I'm sorry, Jerry. All right, Ms. Renda.
What level are we talking about? Because if we're talking about a counselor level being in there, is there also clerical support or clerical backup? If they're meeting with someone, would someone else be there?
That's on the day that the state would be there, but we are working on putting someone else there based on the input that we get.
I guess what I'm not clear about is if we're asking them to put one person there, is that person going to be a counselor, or is that person going to be a clerical level
Counselor.
receptionist?
Counselor, that was stated in the motion.
A counselor. Okay, so if we have a counselor there, and would that counselor see walk-ins? Is that what the idea would be, that they would actually be able to see people who walk in?
Based on our legal procedures, if we can see walk-ins, yes.
Okay. And my concern about that is then would someone else be there that could see other walk-ins if that person is tied up seeing someone?
Yes, that's on the date that the state is there.
So the state provides a receptionist that would take care of any walk-ins while the consul would be seeing other people. Is that right?
That's right.
Okay. That's what I was not clear about.
And I think that also the people, we could schedule people that come in from Sorrento. It's just as close to go across the river as it is to come to the building here in Gonzales. And we're going to just do this on a trial basis?
Yes.
Trial
Well,
basis.
Mr. Ryan is shaking his head, so can we get him to
Would-
come up
No.
to the podium?
And I'm wondering,
No.
would that involve hiring new staff? I mean, not that we can't do that, but would that involve?
We shouldn't have to.
Not on the trial base. Let's try it first.
And then if our needs program comes up that we really need more, we're going to have to staff the whole building later on.
Certainly, that's I guess just what I was wondering is
Yeah.
if we wanted
So
to
we
do
try-
that
we're
prior
doing
to
this
finding
on
out
a
what the need is.
Trial run right now with the people that we talked to in Donaldsonville that claim they need it right now. I don't
Okay,
know.
so it's based on the contacts y'all have had and people saying that they really do need it and it's not
Right.
open.
Okay. Do
We found
call-
that there's no one there.
There's no one there, and they're being referred to way to Gonzales, and they can't meet the needs of the appointment because they don't have the transportation.
Okay.
So, I mean,
Can
we have
call-
to start somewhere. So I figure we start here, see how it's going to work out. And I don't see a problem with them sending someone from Gonzales to the Donaldsonville clinic. It's not going to be an impact on their work performance with the high technology we have today. So it shouldn't be a problem at all.
Could we call on a vote on this now?
Well, I'm just wondering,
Oh, okay.
are we sure, that Dr. Susan has someone that she can just send,
They got somebody go over
we're
there every
supposed-
Tuesday, supposed to be over there every Tuesday and Thursday already.
Yeah, I realize that. But what I'm saying is, you're going to take someone that's already doing a 40-hour work week workload, and then you're going to have to possibly be shorthanded on this side. Shouldn't we look at hiring someone?
But no,
At the last meeting.
my thing is,
At the last meeting, we were told that we had two people going over, one
Well, I
one
understand.
counselor going
Going
twice a
over
week
there twice a week.
already.
Yes, I agree, and there's not. And
So
there's
we
no one there.
just want to reinforce that's supposed to be already happening.
But was that person only going if they had appointments? And if they didn't have appointments, were they being scheduled, was their schedule being booked up in?
but see, that's where the problem came in with this particular person that I brought up in December. She called, made an appointment. It was canceled 3 times. Okay, so she couldn't. She was in Gonzales area, which I don't have to go through all that
Mr.
again.
Butler,
but
that was a
that's one of
state
the-
client.
a
That wasn't
state-
an essential consulate.
Well-
It wasn't our client. It was the state's client. So I'm sorry
It was turned over to the state.
I'm sorry to embarrass you, but
No, you
it wasn't
didn't
our
embarrass me.
complaint and it wasn't
You
our
did not
client.
embarrass me, okay? Because number one, you didn't speak to that individual. You told us you did.
Actually,
but you
I did
didn't.
speak to her.
Okay. Well,
To answer your question about do we have staff, our staff is booked well into April. If you'd like me to reschedule those clients so someone can sit in Donaldsonville, that's fine. We have a substance abuse counselor who goes every Tuesday morning to Donaldsonville. She's built up a good clientele. She provides good services. But she comes back in the afternoon. She has no clients scheduled. If you want someone to be there all day, I'm sure she'll be happy to take her paperwork and sit in the afternoon. But she has clients and groups scheduled now, so we're going to have to shuffle all that around. I don't have anybody who has empty afternoons or empty days.
My thing is on a professional level, because I'm a professional, okay? On a professional level, I don't see with high technology they have today why she can't do the same job in Donaldsonville as she's doing in Gonzales, okay? I've been on this board long enough to know this, okay? Computers is accessible. All these emails I see here, so some work getting done somewhere, okay? I get emails after emails from you, from everybody else. I mean, I done got emails where I done been falsely accused many occasions.
Mr. Butler, the counselors don't send emails. They have to see the clients hour by hour.
Let me finish.
And there are issues of scheduling and safety and clerical support and management of records.
On the floor, please.
Madam Chairman, may I restate the minutes? Dr. Midnoff stated if the board...
We got a motion on the floor. We need to vote on it, and then we will discuss things. Please, I believe we have a motion on the floor. We need to vote on it. Do y'all? I think, let's vote on it and see. Mr. Lambert?
Well, I mean, I'm all for, and I know we need service in Donaldsonville, and I'm all for it. If we need to hire the right people, as an advisory board, we can make motions, and look into whatever we have the right to do.
Okay, she stated this be by April the 1st. If Susan cannot clear agency by April the 1st, then we could advise to hire one.
Well, whatever needs to be done.
If we pass this tonight. Okay.
Yeah, I'm for whatever needs to be done, but I just think we need to cooperate with a little bit with Dr. Susan and not expect her just to just take someone off her staff and put over there.
Well, we don't have nobody over there. That's what I'm saying.
I'm all for it.
Nobody's over there. I don't know what's the problem.
I'm all for that.
We go.
Yeah, I agree.
You know.
I think we all, the bottom line is that we all feel like there should be someone there.
Exactly.
It's just a
They're
matter
getting paid
of
to do a job. I mean, hey.
And who goes?
There.
We're going to leave that up
You know?
to Susan, and we're going to try to work with the people in Donaldsonville to get clients. I mean, they claim they're there. We're going to find out if they're there, and we're going to try this for a few months. And if it don't work, we ought to, by August, I think the 31st, we should have our needs assessment back in.
Yes.
Okay.
Okay.
Okay. So this motion passes. Now then, let me see where I am on. I forgot, Celeste, the budget. Skipped the budget twice.
Actually, all I had to say for the budget was that last month Susan did give y'all the January reports. She gave you the expenditure and she gave you the revenue. At that time, we didn't have the account activity or the open encumbrance. Tonight, I did put that in your budget report so you can look over it, and if you have any questions or comments in regards to it, just...
And from now on, we're going to present the budget from the month before, where you have time to go over it with us on the second Wednesday of the month.
Yes, ma'am.
And there will be no rush for finance. If you don't get it to the 15th, it's impossible for y'all to get it to us, for us to go over by the 15th.
Right, and I actually didn't receive it today, so I wouldn't even have had it for the meeting.
Okay, so we're going to make our business to have our budget 1 month behind, and I don't believe that's going to hurt any facts. Thank you very much.
Madam Chairman, before you move any further, Ms. Baptiste was trying to inform a statement that she had in which we done voted on it already, that in this minutes here, that if the board would like someone in a Donaldsonville clinic from the parish, the director stated that she would be glad to staff the office.
Yes, sir.
That was made by the director.
Yes, sir.
And I just wanted to clarify that up. She did make that statement. to the public, and whereas to the citizens of Ascension Parish.
And Ms. Baptiste, I apologize if I cut you off. I didn't intend to do it, but we had a motion on the floor, and sometimes our discussion, we need to go ahead and vote on it, and I do apologize.
Your apologies accepted. That's why
Thank
I
you.
read these minutes
Well, and you
before
had
I
read-
made the motion.
Exactly.
Thank you, ma'am.
All right. Any new business?
Yes. Committee, as
Yes.
far as remodeling the Donaldsonville Clinic.
You are the committee, Mr. Butler. You are
Okay.
appointed. And would you
And
like
I
to
would
have
like to let Miss Susan Middendorf know that she must come through the committee as far as taking care of the repairs on the building from here out, and let the committee get back to her on any needs that need to be done there, due to the fact like this packet I have here with the roof. That's why I told her to table it until we get the committee together to look over it. And anyone that want to be on this committee, I would appreciate if you join, so we can get this on the move and get this business taken care of, as far as the building getting painted. And as far as my interpretation, in the packet we got in our last meeting, that there was no damages to the roof, so we can at least look forward now, since that's behind us. You know, it was told to us, brought to us, map diagram, that the roof didn't need any repairs after it cost us $1,200 for an inspection. That something I guess we can't control. But for someone to come out, it's awfully a lot of money for somebody to come out and look at a roof for $1,200. I don't see that.
Now, Mr. Butler, your committee reports back to the whole board, and we make decisions from there.
Yes, ma'am. And another new business, as far as, well, I'll get with the committee on that before we come back for the next meeting.
And we can look
As far as choosing bids for this, that, and the other.
Yeah, look into letting your bids and all that.
Right.
All right, appreciate that. Is there any other business that should be brought up tonight? Anybody, any questions? If not, can we get a motion to adjourn?
Make a motion, we adjourn.
I'll second.
Thank you, ladies and gentlemen. Ladies and gentlemen. Thank you.